Good morning, good afternoon, and good evening, everyone. My name is Kate Graham, and today we're going to talk about the Challenge Initiative, or TCI's journey towards self-reliance. Today, I'm joined by my two colleagues, Paul Niachai and Maheen Malik, so welcome, everyone. We ask that throughout the presentation, if you have any questions, to please type those into the chat box, and Maheen will help answer those live. And then we'll reserve a few minutes at the very end of the presentation to address any remaining overarching questions. So TCI is a family planning and adolescent and youth sexual reproductive health platform where local governments self-select to participate. Cities are encouraged to own their own family planning programs and work towards self-reliance by demonstrating their political and financial commitment. TCI's best practice interventions are right-fitted for the local context and updated through continuous learning and housed on our TCI University, a coaching and learning platform. TCI also believes in near-time and real-time data for decision-making. Currently, we're working in 11 countries in Africa and Asia with our 5 partners, CCP, PSI, JPIGO, IntraHealth, and the Zwillig Family Foundation. TCI's goal is the greater self-reliance of local governments to scale up family planning and AYSRH best practices, leading to sustained improvements in urban health systems and increased use of contraceptives, especially among the urban poor. If governments can self-reliantly implement these best practices, then both the health impact gains and improvements in the health systems can be sustained. And we know that sustainability is critical in achieving self-reliance. TCI is built on 4 foundational interlocking tenets: scale, impact, efficiency, and sustainability. And these are at the heart of TCI's philosophy. TCI believes scaling without impact is empty scale, and impact at scale without being more efficient is not viable. An efficient impact at scale that is not sustainable will not produce lasting change. And TCI delivers on all 4 tenets, recognizing that one without the other 3 is inadequate to achieving enduring progress. Now, today we'll focus on sustainability and how we ensure the local governments continue to implement their programs, even when our engagement with them diminishes over time. So the 4th tenet, sustainability, is so key to our approach that TCI identified 4 sustainability pillars to measure movement towards sustainable scale-up of high-impact family planning and AY programming and outcomes. These 4 sustainability pillars signal a city's progress towards greater self-reliance. With pillars 1 and 2, these are common measures of sustainability. Under TCI, the local governments must buy in to be a part of TCI, and this really starts from day 1. Before we engage with these geographies, they must submit an expression of interest to work with TCI. And throughout our engagement, we ensure that the budget allocations that they commit do continue to increase and are spent. Under Pillar 2, that's where TCI University has its high impact approaches codified. The local health management teams, along with support from TCI, also design a program that identifies which high impact approach to use within their program using the 20-80 Pareto principle rule, which is 20% input producing 80% output. Pillar 3 seeks to more meaningfully capture system changes resulting from TCI's approach. The proven approaches at all levels of the health system must be institutionalized so that they can be sustained. And during our engagement with the local governments, we ensure that the high impact approaches make their way into the state or city work plan. So once TCI graduates, these interventions will continue. Under Pillar 4, this is the health system changes and the sustained improvement in health outcomes. So what we do is we help strengthen the government capacity and ensure that there is both supply and demand from the community, so there is constant demand of family planning from the women, men, and youth. TCI envisions graduation as a process and recognition of sustainable success and not as an exit strategy or a one-time event. We want the local governments to celebrate this event as it indicates that they've moved towards self-reliance. This does not, however, mean that the local governments do not require additional support or funding, but it means that they're able to really coordinate their own family planning and AY programs. They're able to coordinate between the donors and the different implementing partners, and they continue to increase their local contributions towards family planning and AYSRH interventions, and that they ensure that that funding that has been earmarked for these interventions are in fact released. And often people confuse self-reliance with the fact that the local governments no longer need additional funding or support. However, they may continue to need support, and that's okay. They are really, the goal is that they're the leaders and drivers of their program, and that they're able to connect those different dots, and they own their own family planning programs. Now, graduated geographies can join TCI Alumni Network, and they're eligible for ongoing opportunities that arise within TCI University and TCI. In the future, if the opportunities arise, we layer on additional health areas or technical areas. These graduated geographies that are performing well will be given preference over other geographies. Also, graduated geographies that have and continue to perform well can work with newer local geographies to help onboard these locations because of their experience and expertise in implementation. So, how do we make the decisions to graduate these cities? We triangulate qualitative and quantitative data. For the qualitative data, we use the RAISE tool, which we'll talk about on the next slide, and the most significant change technique, which collects stories from our beneficiaries, like the local governments. In addition to this, the hubs and TCI Global use what's called a pause and reflect, which looks back at the past quarter, looks at the challenges and any course corrections that are needed, and how to really apply those learnings to the next quarter. So it's not just about using one qualitative indicator, we use several qualitative indicators to make our decisions towards graduation. For the quantitative indicators, we ensure that the local governments use near-time, real-time data on a daily basis to make their decisions. And we put a lot of emphasis on the use of HMIS, as this is a government system and it will remain despite any project. So that may mean strengthening how the data is being reported into HMIS and pulling those numbers from HMIS. And that may mean more data quality audits from the health facility level to the city level so that all data is meaningful and can be used for decision making. The reflection and action to improve self-reliance and effectiveness, or what we call RAISE, as I was talking about. This is a management organizational sustainability tool that helps the local government team systematically self-evaluate themselves and the effectiveness of their FP and AY programs. The structure and process is one in which it's very participatory. So it gives the opportunity for people to discuss and give their feedback, and it allows everyone to feel confident and comfortable to give their discussions and self-assess themselves and their program and make decisions or course corrections for themselves. So TCI is able to then track the city readiness towards graduation along the continuum to influence any additional technical assistance or coaching needs that are identified from these assessments, and that if the local governments require any additional support, we can then help strengthen that in their program. The intended outcomes that we expect to see are that the cities can then self-assess their management and technical performance, like how well they are coordinating with the different health departments, coordinating with the political government, and coordinating with the people that are responsible for HMIS and those that are responsible for ensuring the implementation is happening at the city level. The health system strengthening and the capacity building aspect of TCI is also assessed using this tool. So the tool also helps the government measure the intensity and effectiveness of their programs. Now, based on the results from the RAISE assessments, the cities then develop an action plan and identify who will be responsible for each of the different parts, which Paul will talk about later on. For TCI, we use the results to help identify which areas we need to prioritize or improve on. We track the progress and results along with the data triangulation to again help inform our decisions for graduation. So those that we expect to participate in the assessment is a combination of the health management team, the political team, and the private sector representation. We also ensure that adolescent and youth have a voice at these meetings and that youth are well represented, because this ensures that the local governments hear from this group and they know what those needs are and what needs to be done in those different areas. So how is the RAISE assessment conducted? First, the stakeholders that I mentioned will take the individual assessments. Then they come together as a group to discuss and come up with a decision for what the score should be. And then at the city level, ensure that there is a consensus for where the city stands with the different indicators. So based on the results, action plans and implementation work plans are developed for the quarter or year. Some indicators can be addressed quickly, while some may require more time. A timeline and a person responsible is then added to each of the areas identified to track if and how they are meeting their targets for achieving the different activities. So initially, the process is led by TCI. They facilitate it and they ensure that it runs smoothly. Over time, however, to ensure sustainability, TCI will progressively transfer those facilitation skills to the local governments so that all future assessments are conducted by the local government staff with very minimal TCI support. Now, based on the RAISE assessment scores, the city is identified as either in the beginning stage, where they are just getting their program started and require more intensive coaching and support, versus the cities that are capable of now responding to and running their own programs and require only a very minimal support. So once a city reaches a mature stage at the very top, which is a score of about 85 to 100%, they are then eligible for consideration to graduate, since they have the high likelihood of a long-term sustainability when TCI eventually phases out. So how have we applied learning? The tool was first developed and institutionalized in East Africa, but over the course of the past 9 months or so, all 4 hubs have taken the tool, tailored it to their context and needs, and have rolled out the assessments. Now, in 2018, when we layered on our adolescent and youth sexual reproductive health program onto our family planning program, we had a discussion whether we should have 2 separate tools or 1 tool, but we did make the decision to combine the tools, and we have 2 separate columns, one for family planning, one for AYSRH, and the cities assess both. Now, because the AYSRH program started on later, it is possible to see that the FP program can be at a mature stage, while the AY program can be at a beginning stage. So the 2 scores may or may not coincide, but the objective is that over time the cities do see both scores increase. Other learnings included the need for flexibility in the indicators. And so our hub partners have tweaked their tool and their indicators. However, certain indicators we did say are set and standard, and those would be our M&E indicators. We also revised the scoring criteria because as we added more indicators, we did have to change the weightage for each domain. So what have we seen so far from rolling out the RAISE tool? Out of the 97 cities TCI is currently working in, 28 cities have moved into pre-graduation, and based on the RAISE assessments, of those, 17 have actually shown significant improvements and are poised to graduate in the next 3 months. The average RAISE scores have actually increased by about 15%, with improvements seen in the local ownership and accountability, how coaching is provided, and public-private partnership indicators. And at the city level, the cities use the RAISE results to help modify their own coaching plan and ensure that the trickle-down coaching that they provide includes not only the high-impact approaches, but also the management coaching, which is very key. And there is close coordination with the political leadership throughout this process, as they are actively engaged with the assessments as well. So what have we seen across the hubs? Since I mentioned our East Africa hub first initiated this, you will see that they have completed more rounds than the other 3. But overall, what we've seen is a consistent increase throughout most of the locations. Some scores were, however, affected by COVID and the countrywide lockdowns, but overall we have seen an increase. Interestingly, we've seen that the tool can help show the real-time situation, as we have seen that during COVID, certain indicators were impacted, which we're seeing coming across in the certain domain scores within the RAISE assessments as well. Now, going back to the different hub partners, within Francophone West Africa, Senegal has been consistently increasing over the rounds. However, in Benin, there have been some problems with HMIS system. However, we are working to ensure that while they are improving in their qualitative assessments, they should work towards improving their quantitative indicators as well. In India, which started a bit later than the other partners, we are seeing that over time they have been consistently increasing in Uttar Pradesh within the 20 cities that we're currently working, and there have been cities that have been prioritized and primed and ready for graduation based on the RAISE assessments. In Nigeria, there are 5 states consistently showing improvements, and those states are in discussions with the government so that they're ready and primed for graduation as well. And with that, I would like to hand it over to my colleague, Paul Niachai, who will take us through the experiences within the field. And with that, thank you so much, Paul. Over to you.
Thank you very much, Kate. Once more, my name is Paul Niachai, the Chief of Party for TCI in East Africa. Today, I will be sharing with you some experiences from the field on the RAISE process as part of improving sustainable programming. For us, this process has primarily facilitated better and targeted coaching by both the hub program teams who support the implementation, as well as the city local government teams mainly from the Ministry of Health, who are responsible for reaching or implementing the family planning and AYSRH programs. From the assessments, the teams have been able to break down their performance in the different sustainability domains, and this is what Kate had mentioned earlier, and identify the gaps, plan for them, and even identify specific individuals be responsible for implementing the action items. You will see in this slide the examples of such coaching actions that we use after every quarterly assessment. And in East Africa, for example, in this assessment done late last year, the gaps were primarily on domain 2, which is the capacity transfer, and again on such elements as the use of coaching and HMIS. The local government teams also identify who's responsible, and most of the responsibility will typically fall on the local government team members. They will also propose the timelines and identify resources needed to ensure these coaching action plan can be implemented successfully. This is a similar example from West Africa, looking at domain 3 on political commitment and institutionalization, and the efforts at improving elements such as financial management and private and public partnership. This also happens similarly in India and Nigeria. In facilitating the decision-making process, we do work with the cities to triangulate the RAISE results with other data such as the HMIS, the Health Management Information System, that give us indicators on the percentage change in annual client volumes and the annualized modeled MCPR changes. Here we can see concurrence in the RAISE assessment results for some of the cities as they're increasing, with the HMIS data giving us confidence in making decisions on whether these cities are on track in their journey to achieving self-reliance and sustainability. We do have feedback from the various local government teams on this process and how it helps improve their annual work planning process and identify specific areas that can be targeted for improvement. And I think this is something that has come up repeatedly across all the hubs. As you know, most of last year we had COVID, and cities did try to find innovative ways to conduct their quarterly assessment, including indoor or outdoor meetings. As you can see also the examples from some of the locations in Tanzania, Uganda, and Kenya. Some of the cities we have been coaching have reached maturity based on the assessments, and at the moment have graduated and ceased from receiving financial support from the program. For these cities, they have found this process to be valuable and are even moving towards adapting the same in other program areas such as HIV. To them, this process has also facilitated a mindset shift on how they implement programs with the end in mind and with the utilization of data for their day-to-day, their quarterly, and even annual planning. This is a photo from Uasin Gishu in Kenya, which is one of the graduated locations on a RAISE assessment, and this is something that they are continuing even post-graduation. And for this county, this process has been used to facilitate recognition and even reward ceremonies for facilities that have met the goals as defined in their work plans, for the coaches that have contributed to achieving sustainability milestones, and so forth. In summary, some of the reflections and learnings from the RAISE process is in this being a reminder of the considerations that have to be made by cities when doing their annual work plans, the kind and source of fundings, and the critical timelines that they have to take into account when doing their planning. In implementing, it is important to have multi-sectoral teams participate, teams coming from finance, the middle managers, the data folks, and even having facility and health workers as part of the team. This is really critical. Being an interactive tool, enables debate, and this facilitates honest scoring. And for instance, when they have to determine qualitative domains, such as whether their leaders are actually supporting them in their FP programs, this is something that really facilitates them to debate and come up with one conclusion that represents the group's scoring or rating. It is also important to ensure that local government teams close the feedback loop on the gaps and actions that are targeted at the various decision makers across the system, whether these are the data teams, whether these are leaders who are responsible for the financials, or whether these are even community members. Finally, as you may appreciate, the assessment does take time to administer, and this is something that the local governments have to take into account and plan accordingly during the quarterly assessments. Thank you so much for your attention. I would request that if you have any question or anything that needs clarification, please do take a minute to put it in the chat, and we will try and address it accordingly. Here also are our email addresses, and do feel absolutely free to reach out at any time for comments or any questions or feedback that you may have related to this presentation. Thank you very much.